Hi guys, Andrew from the Functional Movement Group here. The action's holding up at the Australian Open at the moment, and that means that people are dusting off the old Jimmy Connors special here. They're taking to the courts and they're getting back into playing a bit of tennis themselves. And one thing that we find when people are getting back into playing tennis is that people develop forearm type injuries or forearm pain. Usually most commonly those tennis elbow type issues on that lateral elbow through here. Usually what we find is the reason for that in most acute cases is because there's just too much load and too much stress going through these little muscles through here. They're not really designed to create a lot of power. They're quite small muscles. They connect over a fairly small surface area at the lateral elbow. And it's usually because people are just being a bit too armsy with their shot play. They're really grabbing the racket quite hard, trying to generate power through their arms through here. What the problem is that doing that is quite inefficient. What we need for a really powerful stroke or to play quite well is to make sure we're loading from these bigger muscle groups, so through the hips, through the trunk. What that does is cause proximal acceleration. So what that means is that when we load through the trunk through here, we're generating the power through here first, and then the arms are finishing it off. Same on the backhand, we're really loading through the hips, those big muscles through there, and then the power comes through that. The arms are the thing that just speed through and hit the ball. So what we can do to correct this, if we have someone who comes in to see us and they're suffering from this type of pain, is the first thing might be trying to address some of the skill set in terms of what they're doing. Are they using their body in this way? Do they utilize it effectively so that they're not putting too much load through their arms? That's probably the job more for a tennis coach or someone who's skilled at the game. For us who are therapists or trainers though, we can look at some other ways in which we could maybe help these type of people. So for example, we could use some training ideas to try and develop some strength and control in through the hips and through the trunk. It might be something along the lines of using some different lunge type matrices where we're really loading through the hips, potentially in the sagittal, the frontal and the transverse plane. We could also use some different arm drivers to help facilitate that load through the back of the hip there. So something like a lunge with a rotation to the same side to really drive that load in through the hips and through the trunk. If we're a manual therapist though, and we use our hands to do a bit of treatment, we might want to look at does this person have the range of motion or the ability to utilize these areas effectively so they can actually load through there. So it could be a case of needing to try and facilitate a bit more internal rotation through the hip, or potentially some more rotation through the spine, really using that transverse plane so that they can really load through that kinematic sequence and make sure that they have an efficient movement that's powerful, that isn't putting too much load through the arm. So I hope that's been some helpful tips for you for any of your patients or clients that come in maybe suffering from that elbow pain, and keep tuned for some more videos from the Functional Movement Group.